All right. Good evening. Good evening. Good evening. Thank you so very much, all of you guys, for joining us for our third annual Opioid Roundtable. My name is Sayram Selassie, and I am the Executive Director of the Agency for Substance Abuse Prevention. Simply, who we are is a prevention agency. We don't do treatment, we don't do counseling. However, we have connections with community partners and other people around the state that allow us to make sure that all of our consumers receive the services that they need. I want to first of all start by thanking each and every one of you guys for joining us this evening. You could have been anywhere else on this rainy night, at least in Calhoun County, but you're here with us showing that you truly care and are concerned deeply about this issue that we're getting ready to discuss. So let's jump right into the purpose of why we are here this evening. Right now, you guys, I'm just going to call out the elephant that's in the room. We have a pandemic on top of an epidemic. Let me say that again. We have a pandemic that is on top of an epidemic. And let me just kind of break down some numbers really quick. Nationwide, 81,230 people have died from drug overdoses between June 2019 and May 2020, according to the CDC. In Alabama, at least 20% more died from drug overdoses during the most recent 12-month period than during the 12 months prior. And locally, we know at least in Calhoun County, our overdose death numbers have doubled from 2019 that year until 2020. Now, there's social isolation because of the pandemic. There's depression. There's a lot of people don't have right now the access to the resources that they normally get. So we know all of those things are compounding all of the issues that people are currently facing and making these numbers rise. And when you think about the numbers and all of these statistics that I just laid out, they aren't just numbers, you guys. They're someone's mother, a father, an uncle, a brother, a sister. So we know even in our own community that we look past all of that and understand that these are real people's lives that are being lost. So the purpose of this program is to let people know, don't give up, that there are community partners and people around here who truly care and want to see people stay alive and get the help that they truly need. Part of that in our local community, we know that heroin right now is one of the biggest culprits of many people falling into overdose. And right now you're going to hear also from someone, our local coroner, Mr. Pat Brown, about more information dealing with that. So last but not least, the whole mission and idea of this platform, of this opioid roundtable, we want people to have hope. And hope for us at ASAP is an acronym. And hope stands for Hold On, Pain Ends. And you guys will learn much more about that as we proceed through the forum and the panel this evening. So right now, I just want to lay out how the evening will go. We definitely want to make sure that people get the information that they need. We have some very special speakers here, so let me talk about the agenda. First, we'll have Dr. Nicole Driver, if you could just kind of wave your hand. She's with the Alabama Department of Mental Health. And if the speakers want to give further bios when they start, that's completely up to them. But I want to get right into the subject matter at hand. The second speaker will be, as I already mentioned, Mr. Pat Brown. He's our local coroner. If you could just wave your hand. Thank you. After Mr. Pat Brown, we have a local physician, very good local physician. His name is Dr. Howard McVeigh. If you could just wave your hand. All right. So there's Dr. McVeigh. After Dr. McVeigh, we have our Northern District U.S. Attorney, and we really appreciate her taking time out of her busy schedule. Her name is Prin Escalona. If you could just wave your hand. Thank you. So after those speakers go through their particular presentations, then we're going to have what we call our ASAP intermission. Now, this isn't an intermission where you just kind of go and get some popcorn or things of that nature, but it's actually going to be an informative intermission, and we'll talk more about what we do at our agency and resources that are available. After that, we listened to all of you guys last year who joined us at our forum right there at the bridge in Calhoun County and Anniston. And many of you all talked about, you wanted to hear from people who are actually in recovery. So we have two very special speakers from the Anniston Fellowship House who will be telling their stories. Their names are Mr. Jeremy Jones, if you could just wave your hand. And we have Mr. Billy Martinez, if you could wave your hand as well. All right. So again, I want to thank everyone in advance for joining us. Hopefully, you'll really learn something and get something out of tonight. Now, obviously, you guys may have specific questions for different panel members. So what we want you to do, I have to thank, first of all of my ASAP staff that are here at the office with me that are doing their best and making sure that we all social distance, but they're going to be monitoring the chat boxes. So let us know in the chat box, A, what your question is, B, who that question is particularly directed to, so we can make sure that we address it at the end of the program. All of the presenters are going to go through their presentations, and at the end of the program, then they'll be able to answer your questions. Next, the continuing education. So today's session is eligible for 2 hours of continuing education. Bradford Health Services, who we thank, is providing these continuing education contact hours at no charge to you. After the conclusion of today's presentation, you will receive an email with a link to an evaluation. You must complete the evaluation in order to receive credit for your participation. Certificates will be sent via email to those who complete the evaluation within 1 week. So again, I repeat, you'll have 1 week to complete the evaluation. We were expecting a large crowd, as you guys can see now, for today's event. So your patience is appreciated in advance regarding the reception of the education components. And last but not least, we also will be sending out an ASAP survey. You guys will get that in the chat box as well as in your emails. So we want you guys to please fill that out. And what that does is just give us the simple community feedback that we need in order to make our future roundtables more effective and just more beneficial for the community as a whole. So right now I'm asking all of my fellow panelists to go on mute as well as remove your videos. And now we're going to go into our very first speaker, just a wonderful person. I can't say enough about this individual. She worked so hard for the Alabama Department of Mental Health day in and day out. Again, she manages all type of different grants and consults with different agencies, prevention agencies. And again, her resume just goes on forever. But I want to welcome and please just give a virtual round of applause to Dr. Nicole Driver. Thank you.
Yay. And I'll give a round of applause too for all the work that you all are doing, ASAP. I'm very proud of you all. I'm Nicole Driver, and I work with the Alabama Department of Mental Health and Prevention Services. And I'm just very excited to be here today. I think that this is a very wonderful initiative and one that is it can change lives. And so again, I'm just very happy that I have the opportunity to just share some information with you all and to talk about prevention services with the Alabama Department of Mental Health. I am the SPIF RX consultant, and I also work with the CCI initiative. The SPIF RX initiative works with prescription drug misuse, and the CCI initiative is the community college initiative, where we talk about underage drinking at our local community colleges, but we also work with some universities and colleges throughout the state as well. Again, it's very vital, the prevention aspect and the things that we do. And I want to kind of talk about that a little bit. I don't want to take anything away from treatment. Let me go ahead and say that right now, because treatment is very important and it is very vital. but I do want to kind of key in on the prevention mechanism. And the reason that I want to do that is because, things took place in the state of Alabama, and some things are taking place right now within the state of Alabama. And I'm going to keep it on topic in retrospect to opioid abuse and misuse. I don't know if you all remember or not, but back in 2018, opioid use and misuse skyrocketed. So much so that, for the most part, states were dealing with it, but Alabama had the highest prescription rate in our country. And I want us to really think about that, the state of Alabama. Rates, however, at this point they have went down, but it's still nearly twice over the U.S. average. And so again, we are embarking upon a problem here, and an issue that we all have to kind of work together and combat. I want to talk about this too, because opioid emergency room visits continue to skyrocket over 81%, and we continue to deal with that particular initiative. And then I want you all to listen to this. Nearly half of the 775 reported drug overdose deaths here in the state of Alabama in 2018 involved opioids. There is a serious problem here in the state of Alabama that we have to address, and we have to deal with, and we have to combat. The Alabama Department of Mental Health Prevention Services, we try to do just that. If you think about prevention, we are trying to prevent. We are trying to, have it where it doesn't occur. We're trying to combat the problem before it gets to something that is much bigger, such as treatment. We have an initiative. It's called the OD2A. Let me repeat that, OD2A initiative. And it's a 3-year initiative that is sponsored by the CDC, in conjunction with the Alabama Department of Public Health. And this particular initiative tries to tackle the opioid matter that we have here within the state of Alabama. It tries to strengthen and expand statewide opioid prevention efforts, but to get that message out to our constituents here within the state of Alabama, but also educating our citizens here in the state of Alabama as well. As Sayram had discussed earlier, the media campaign for this particular initiative is HOPE, HOPE. The acronym stand for H, hope, O, on, P, pain, E, ends, because we want to hold on so that the pain can end. But again, we cannot do this without you. We have prevention providers here in the state of Alabama, and those that work on this particular initiative, I want to recognize them tonight. Northwest Alabama Mental Health in Jasper. Of course, we know ASAP, the Agency for Substance Abuse Prevention, right in the Anniston and Oxford area. Council on Substance Abuse, COSA, in Central Alabama, Montgomery. And then South Central Alabama Mental Health, which is that lower level of Alabama, in Andalusia, Alabama. But again, it's only so much that the Alabama Department of Mental Health can do. It's only so much that providers can do. Look at what is taking place right now. We have ASAP, who is reaching out and providing this message. They are working with their their coalition and other community providers. And I have to give a hats off to Bradford Health Services for coordinating this effort with them. But this is what it's all about. We want to try to provide that message now so that it doesn't, get to a point where, what we're dealing with right now, people in treatment, people, this whole thing with the opioid crisis and epidemic hurting families, where, here in a moment, we're going to hear from a coroner. We're going to hear from a doctor. Again, we have our U.S. attorney. Again, we want to, from the prevention side, try to combat that. And again, we have to, work together as a unit. I love the opioid roundtable because, again, when this first started out, it started out with about 150 people, and it continues to grow each year. We have some folks that are logged on in today that are not just from Calhoun County or the Calhoun community, but throughout the state of Alabama. And that's what we want to do. We want to educate, but we want you to take that message back and spread this within your communities and within your counties. Because again, things that we do, we need to understand for the most part that, they are, statewide initiatives, because we want the state of Alabama to be better. Again, this is a initiative, the OD2A, that we think is, one that can help combat this challenge. And I want to break down those acronyms. O stands for overdose. D stands for data. The 2 is the number 2 for 2, and the A stands for action. Everything is data driven. And we know that the data is, shows that right now we have a major problem here in the state of Alabama as it relates to opioids. And so again, we want to just, take the time and let you all know about this particular initiative, O2DA, but also, OD2A, excuse me, but also prevention services with the Alabama Department of Mental Health. We are here. We want to, again, promote messages about opioid abuse and misuse, but also substance abuse and, other things that are going on here in the state of Alabama that are crippling individuals, crippling families, and just crippling the state of Alabama. Lauren Blanding is actually the consultant for the OD2A initiative. And if you all, if someone could put her name and her email address up, she works also with the Alabama Department of Mental Health, and she can provide more information in regard to this particular initiative. And she can also direct if you have other information, or if we can provide other information in reference to prevention initiatives that we have with the Alabama Department of Mental Health. Again, I want to thank ASAP and thank them for the opportunity to allow me to come and just address a little bit, because I don't want us to forget about the prevention services that we have here in the state of Alabama. They do work, but again, as a whole, we have to work them together. I'm getting told that I've kind of went over my time and I can get a little long-winded. So again, thank you all so much. And thank you, ASAP and Bradford Health Services, for this particular opportunity.
Thank you so very much, Dr. Driver.
Thank you.
Obviously, because of what we do through the work with you, we know how important prevention is.
Yes.
And I always love to quote one of the founders of our country, Benjamin Franklin. He said, "An ounce of prevention is worth a pound of cure." And that's all we're trying to do from the prevention side. But now the next speaker, you guys, we're going straight to the other side. If there isn't opportunities for prevention, if it isn't opportunities for treatment and counseling services, we know oftentimes, especially with the numbers that I already mentioned earlier, what it can lead to, which is actually death. So we are welcoming right now our local Calhoun County coroner, Mr. Pat Brown. He's been a very intricate part of what we do here at ASAP, and just, giving us access to information that we need to do the best that we can to be better prevention specialists. So I'm going to allow him to just share what he's seeing out there. So go ahead, Mr. Brown.
Hey, thank you. And I appreciate everyone that's attending today. And as it was said earlier, by the time I see them, it's too late. And, our numbers, when I've been in office I took office in 2007. And I have a unique perspective. I'm also a paramedic and have been in this county for almost 27 years. And for every death that we have in an overdose, there's several that come near death. And back I worked as a paramedic for the drug task force here in Calhoun County, the Violent Crimes and Drug Task Force. And back in 2007, 2008, heroin was unheard of in and around our county. Every now and then you would hear about it in Atlanta and some of the bigger cities, but it has come on the scene here in the last couple of years with a vengeance. And, the progression used to be prescription overdoses. And one of the problems, there are several problems with heroin, but one of the problems is it isn't regulated like a prescription medication is. A prescription medication, there's an exact dose and a milligram that goes into each pill, and what you're taking. With the heroin problem that we have, and even more so this year than last, as it was said, our numbers have doubled in heroin deaths or opioid deaths, and the majority of that is heroin now. And people don't know what they're getting. That's one of the problems. The progression over the last year is where we would have to do investigatory type skills and blood work to figure out what happened to the person to come to the conclusion that it was a drug overdose. In most cases now, with the heroin that we're seeing in Calhoun County, I would tell you that 6 out of 10 heroin deaths either still have a needle in their arm or it's laying on the floor and they fell straight to the floor after they pushed the plunger. And that's a problem. It's a real problem. And as we progress through, it's only going to get worse. I was talking to some friends of mine the other day that work for the drug enforcement agencies, and heroin and other drugs are coming across the border almost unscathed right now. And it's showing up here every day. I would say that this week alone, today is Tuesday. Since Sunday, we've had 2 overdose or suspected overdose deaths. And that's only the tip of the problem. Most of us that hear about it, we hear about it and then we move on about our lives. But the people that are left behind are the ones that are really suffering. The families, the friends, the loved ones, the kids. It's no respecter of person. It's no respecter of race. It's out there, and when it gets them, it gets them. I've talked to folks that as I said earlier, being a paramedic in the county, I have a unique perspective of being able to talk to these folks, and in several cases, able to reverse some of the effects and get them to the hospital and they get help. And these people would tell me, I knew it was going to kill me and I couldn't stop. I knew that when I was pushing the plunger that it might be the last time that I do it. And that's sad. And I appreciate what you guys at ASAP are doing. That's why I agreed years ago to partner with them. And as Sayram was saying earlier, we are sharing our data, and they've got a great staff there that goes through that data, and it really helps me. We're super busy. We don't have the staff to monitor to keep those numbers. And I rely on those guys as much as they rely on my numbers. And so we're happy to share those. And I want to continue to keep it on the forefront, because there's something else out there that'll be coming. We saw some drugs not too long ago that I think they're calling it no-show now. And they're soaking papers in chemicals, and then they're smoking the papers. I mean, people are going to find a way. And the last thing I'd like to say is, as far as prevention goes, you know, if drug addiction hasn't hit your family, I would tell you that you're probably not looking close enough. It's hit my family, and, you know, my nephew, who, if he were here today, he'd be happy to tell you, he is a success story. But more than once has his family got him out of a hotel room near death. Prevention or treatment works, but the one caveat that I like to share with folks so they know, people build up a tolerance to medications, and treatment isn't something that happens automatically overnight. It's almost like if you were trying to quit smoking, sometimes you got to quit several times. And eventually, hopefully, if you're one of the lucky ones, you can make it through it. But what happens in a lot of my cases, and I'll just throw these arbitrary numbers, if you're used to doing 5 of whatever it is, drug of choice, and that's what you did, and you go into treatment and you got clean for X number of months, a year, or whatever, and you digress back into a drug, we see people that think they can handle the same amount that they did before, and it kills them instantly. Not to mention the heroin we've got on the street now. We don't know what it's cut with. We don't know how strong it is. And the people that they're getting it from don't know how strong it is. So I would caution people to pay attention to what is going on. Pay attention with, this is a serious problem that we have in our county. It's unheard of for us to double in numbers. And honestly, it may be more than that, because recently we've changed here in the state of Alabama. We've started listing the type of drug that is responsible for taking that person's life. And at the time of this meeting, we're still waiting on several tox kits to come back to us that was at the end of the year. So we don't have those results back yet. So that number could rise even larger for last year. So I will stop, and I'll stay around. If there's any questions, I'll be happy to answer. If anyone needs me, they can always call our business number, which is 256-237-2399. And someone from my office will return your call. Thank you very much.
Thank you. Thank you very much, Pat. And again, you guys, with this issue that we're seeing, we can't thank our local coroner enough for working with us as a prevention agency. He doesn't have to, but he's working with us as a prevention agency to address this issue, to look at these overdoses and, you know, try to put our heads together the best that we can in order to try to make our community safer. I also want to shout out in advance the rest of our ORT committee. That's our Opioid Roundtable Committee, which is made up of all local prevention, treatment, counseling, coroner agencies, as well as our district attorney. We definitely want to thank our local coalition for working with us to continue to address these issues. So we just heard from our local coroner, and now we're going to go to the medical side, you know, kind of in between the prevention and then final aspect where a coroner has to come see an individual. And he is right here joining us. This is Dr. Howard McVeigh, and he's going to give us his perspective as a local physician on what's going on with the opioid epidemic. So let's welcome Dr. McVeigh.
That's Ron. Thank you. Hi, I'm Howard McVeigh. I'm a practicing physician in Anniston, Calhoun County since 1980. I have practiced primarily in the emergency room for the first 20 years. The last 20 years, I was involved with the incinerator at the depot as the medical director and over the drug testing program. The last 4 years, I've been in some emergency room and urgent care. Joined in urgent care, Care Plus, whose owner, she owns several clinics, has a very mission-minded toward opioid disorder treatment. And she asked me to take the waiver and offer buprenorphine through our clinic, in addition to our urgent care and family practice coverage. So I agreed to do that. So the last 4 years, I've been prescribing buprenorphine naloxone combination for the medical assisted treatment of opioid use disorder. Medications, there is hope and there is help for people who want to stop. There's opioids work on the body in a number of receptors. The most receptors that are the receptor that causes us the most benefit and problem is the mu receptor. And there's 3 ways it can be utilized for medication assisted treatment. You can either block it, you can stimulate it, or you can block it and partially stimulate it. Methadone is the prototypical drug for a medication that sits on the receptor that stimulates it. It doesn't have the highs and lows. It's sort of steady, so it helps people with pain, keeps them out of withdrawal, and allows them to approach a more functional life, or functional life completely. The prototypical antagonist for the receptor is naltrexone. Now, patients really need to be out of opiates out of their system before they get started on naltrexone. It completely blocks the receptor. It doesn't stimulate it at all. If you start it with someone that's has opiates in their system or opioids, then it will put them into a precipitated withdrawal. And then the medication that I use the most is buprenorphine. It's a partial agonist. That is, it partially stimulates the receptor while it's sitting on it and blocks it from other opiates or opioids entering it. It has a very strong bind to the receptor. It can displace heroin, dilaudid, morphine, just about everything that sits on the receptor and stimulates it, except fentanyl. Fentanyl will compete with the buprenorphine on the receptor. What that means is if someone comes in and is on and has it in their system, the buprenorphine will kick it off. It's been characterized as what that's like is you're going 70 miles an hour down the road and buprenorphine comes in and kicks off the receptor. Your receptor's no longer being stimulated by heroin at 70 miles an hour. It's like going down to 20 miles an hour immediately. So it will get a precipitated withdrawal. The way we get around this, or the way we do it, there's different techniques, but the way it works for us is a patient will remain off their opioid medication for 16 hours or so. They negative drug screen. So any person that is addicted, a regular user, will tell you by then they are feeling that they're going to withdrawal. They have, we use the COWS or the SOUS score. I prefer the SOUS score, and I'll tell you why in a minute, and drug screen to know that it's safe to use. We do a very small dose of buprenorphine in the office. It's about a 2 or 4 hour procedure, depending on how much the patient's been using. And over a period of time, we redo the vital signs, retake the SOUS score, and increase the dose gradually. Usually around 2 hours, sometimes as long as 4. They're completely out of withdrawal. They go from feeling terrible to feeling close to normal, and they go home. We see them, contact with them again the next day, and then we see them in a week. Then we see them, if everything's going well, we see them in 2 weeks, and we try to see them just once monthly. At our clinic, we also like to serve as their primary care if that's possible, with insurance or whatever, so we can work with them on other medications. We, in initiating someone, and the process is called induction, we meet with them, have an exam, labs, go through their history, and we do an interview to see if they're, so they know what they're getting into. patients, the most common, I guess, expression, and we talked to them afterwards, after about a week or two. How are they feeling? How are they doing? They think they're at the right dose. They're doing well. Their common thing is, I don't even think about drugs much anymore. I'm not worried about where my next dose is coming from, and I feel normal again. Very frequently, they're tearful with gratitude. It's been a very rewarding new part of my practice. I enjoy these patients, and I'm glad to help them. There is hope. I agree with Dr. Driver. I would rather it all be prevented, but I would like to offer that as a hope for the patients that things can be better. It's changed some lives. They characterize it as a lifeline, and we are happy to offer it to them. I don't have anything else. I'll be ready for questions later, I guess. I don't think I used much of my time.
All right, thank you so very much, Dr. McVeigh, and multiple questions I saw coming in. And again, thank you guys for sending in these questions. Please understand we are going to get to them at the end of every panelist's presentation. So just keep sending them in. Also, thank you, Dr. McVeigh, for talking about MAT. And I know I saw some questions related to that. So you guys are really going to be, if you never heard of MAT, you're going to hear more information about that as well. But Dr. McVeigh just covered a lot of that. All right. So now at this point, we've covered this discussion from the prevention angle, also from the EN angle with the coroner, and then from the medical angle with our local physician, Dr. McVeigh. And now we're going to jump into the law enforcement angle. And again, as I mentioned before, we have our Northern District U.S. Attorney, Prim Escalona. We can't thank her enough. We know she has a very, very busy schedule as well. So she will be giving us a presentation and discussing from her perspective in law enforcement what's going on with the opioid crisis and epidemic. So if Dr. McVeigh, I think he caught it, and now we're going to go right into Mrs. Escalona. Thank you.
Thank you. Good evening. As a parent, I know that it is hard to carve out this time, especially in the evenings. And so I just appreciate everyone taking the time to be here to talk about this important subject. It's important to me. It's important to my office. And I know it is critical for all of you. So thank you for being with us tonight. As you know, the opioid epidemic has ravaged countless communities and tragically just shattered too many lives. We have seen some progress, and we'll talk about that. And the Justice Department and the U.S. attorneys in our community remain fully committed to working with our state and local partners to combat this complex and evolving challenge. As you know, drug addiction touches everyone, no matter the age, race, gender, geography, or socioeconomic background. And we certainly see that with our cases. It's interesting, in our office, we have, in our criminal division, we have 3 sections, and one of the sections is on violent crime, and then section 2 is on public corruption and what we call white collar. And then section 3 is on drugs and immigration. But the interesting thing about the opioid epidemic is that it actually crosses both that section 2 and section 3, because we see it of course, in section 3 when we talk about the heroin and the other types of street drugs and our enforcement efforts there. But we also see it in our section 2, which is our healthcare, where our healthcare fraud section is. We've been able to use healthcare fraud to go after the pharmacists and doctors and others who are prescribing, illegally prescribing the opioids to individuals. And so kind of combining those 2 sections and going at it from 2 different angles. Our hope is that our office is able to really kind of make an impact in the opioid epidemic. And so I wanted to talk a little bit about what we're doing in our office on the enforcement level, but also I'm going to touch on what we do from the prevention angle, and then also from the funding angle, because I think it's important to remember that our office is not just an enforcement office, that we also are looking at ways to partner with our local law enforcement partners, but also our local community partners to see what we can do to really make a change here. So from an enforcement perspective, just across the country, all U.S. attorneys' offices are working to dismantle drug trafficking enterprises in our communities and on the dark net. As I mentioned, we identify and prosecute medical professionals, pharmacists, and manufacturers even who are involved in what we call illegal pill mills. And we're using every prosecutorial tool in our toolbox. So at the department, what the department has kind of done from the national level, it has two initiatives in the opioid space that our office is involved in. So the one is called the Opioid Fraud and Abuse Detection Unit. And this is a program that uses data to identify and prosecute individuals who are committing opioid-related healthcare fraud and contributing to the prescription opioid epidemic. So that, as Dr. Driver talked about, that looking at the data, using that to see where the drivers of the prescription opioid epidemic are, and then what we can do about those. That program operates in 12 federal districts, and we're fortunate that the Northern District of Alabama is one of those. And that has led to a prosecution of over 100 pill mills throughout those federal districts, and with even more that are currently under investigation. The department also in 2018 started what's called the Appalachian Regional Prescription Opioid Strike Force. It's called ARPO Strike Force. And this strike force is focused on pill mills and kind of along the what you consider the Appalachian states. And it includes U.S. attorneys' offices from 10 federal districts. Again, our office is one of those districts. And I spoke to the national coordinator for ARPO recently, and she said that our office is one of the best that she works with. Just our folks are very committed to the mission, and also are very good at going after cases and producing those cases. And that task force works with the U.S. Attorney's offices, but also the DOJ Healthcare Fraud Unit, which is centered at Main Justice in D.C., and our law enforcement partners at the FBI, DEA, and also HHS's Office of the Inspector General. We also work with our state counterparts in the Medicaid fraud units. Since its inception in 2018, the ARPO Strike Force has charged more than 70 defendants who are collectively responsible for distributing more than 40 million pills. Also, so those are kind of the things that our office is involved with that are overseen at the national level. Locally, we also have one of our assistant U.S. attorneys who is a dedicated opioid coordinator in our office that oversees all of our opioid enforcement work. We also have a healthcare fraud coordinator who works in conjunction with the opioid coordinator when we are looking at using healthcare fraud laws. And sometimes we use those statutes because the way that the statutes are designed, we can get more significant prison sentences, and we can get more significant restitution from those. And we have a little bit more flexibility with how we use those. And then we also have folks in our office who work specifically with our district attorneys in each of our counties. And so we have someone in our office, an assistant U.S. attorney who is responsible for Calhoun County. And so she works with the district attorney, Brian McVeigh, there. And they are in, she is in almost constant communication, I think weekly communication with that office about what they are seeing just across the spectrum of all cases, but always with a focus on, violent crime and also in opioids and drugs. And they have regular calls and are in contact on a pretty regular basis. And so I also, when I came on board, had a call with Brian, and we talked about some of the challenges facing Calhoun County. So I'm very familiar with what's going on there. So that is a little bit of what we're doing at the enforcement level in our office. And we're pretty successful with a lot of these cases, and we're very committed to these cases. And so we plan to continue our work with both the Fraud and Abuse Detection Unit and with the ARPA strike force, and use that support from DC as a way to really magnify the work that we're doing here. We understand that although enforcement is often our chief role, that it's not the only piece of this puzzle, and it's really not the only place that we want to be involved. That's why, with our efforts to combat the opioid epidemic, we don't see them as starting and ending with prosecution. We are committed to working with our state and local law enforcement partners and our community partners on ways that we can improve outreach and prevention and treatment programs. For example, representatives from our office have spoken to over 700 students at various schools across the district on the dangers of opioids and in opioid prevention. And once it's safe to go back in the schools, we fully intend to be back and to continue that program. For the past 2 years, our office has been meeting monthly with our partners from around the district to discuss prevention efforts and ways that we can support and magnify those efforts. And then nationally, the department sponsors the DEA National Prescription Drug Take Back Day twice a year. And that's through that public campaign. Collection sites are provided by DEA to offer an anonymous, safe, responsible way to dispose of unneeded prescription medication. And the Take Back event that was held in October of 2020 resulted in nearly 1 million pounds of prescription drugs being collected nationwide. And that's the largest amount that program has seen in the last 10 years of its existence. So we know that we want to be supportive. Want to help lead the enforcement effort. We want to be as supportive as we can of outreach and prevention and treatment. And we also know that one thing the federal government can often bring to the table is funding that helps some of the programs that you're already doing in the local communities. And so, for instance, last year alone, the department's Office of Justice Programs awarded more than $341 million nationwide to combat the opioid epidemic. And these grants are designed to build lasting partnerships between law enforcement agencies and treatment providers. And through these grants and others, the Department of Justice has invested unprecedented levels of funding in combating the addiction crisis. Funding for these projects, I want to mention so that if you see it, you'll know. Funding from the projects that are focused at combating the opioid epidemic come from the department has several grant-making components, and those are the Bureau of Justice Assistance, the National Institute of Justice, the Office for the Victims of Crime, and the Office of Juvenile Justice and Delinquency Prevention. And so our office is always pleased to work with our partner agencies, both law enforcement and our community partners, to support your grant applications, to help you find grant applications, to look for ways that we can support the work you are doing using our by leveraging our federal funding resources. So as you are thinking about grant opportunities, as you're looking for grant opportunities, please reach out to folks in my office, both Lyndon Laster, who is the law enforcement coordinator, and Jeremy Schurer, who is an AUSA that's kind of responsible for a lot of our grant programs. They are wonderful resources, and I encourage you to reach out to them. We know that there is a lot of work to be done to combat the opioid epidemic in our district, and we are committed to continuing to work with our state and local partners. And we look forward to supporting the outstanding work that you are doing in this community. So thank you so much for everything you are doing. Thank you for everything you've done, and we look forward to working with you.
Thank you so very much, USA Escalona. We really appreciate you all's hard work, and all of you guys that are participating. I can tell you guys that just is not hot air. You see our U.S. attorney here. Her employees have also been in our community, coming into schools pre-pandemic and even helping us out virtually during this pandemic and talking to young people throughout our community to make sure that this issue is addressed, to make sure it's recognized. And like she mentioned before, a lot of times we think of the U.S. Attorney's Office as only law enforcement. However, they're really directly involved in many of our prevention efforts. So we can't thank you enough, Mrs. Escalona, and Escalona. And we'll just continue to make things go forward. So I'm sure there will be some questions for you as well, and we'll keep it going. All right. So now, you guys, we are going into our intermission, as I mentioned before. This is an intermission ASAP style. So right now, I'm going to go ahead and start with the screen share. All right. So this is obviously the flyer for our opioid roundtable event. You can see all of our sponsors there at the bottom. So right here, I cannot do any of this work without our wonderful ASAP staff. So to my left, if you're looking at, you can see Mr. Jason Lindell. He's also a certified prevention specialist, CPS. We have above him, Mrs. Aisha Beard. She's a prevention specialist. Next to her, you have Trisha Anderson, Mrs. Trisha Anderson. You have Mrs. Stacy Jackson. You have Miss Maya Northard. And to her right on the far end is Mrs. Kayla St. Eliard. And right below her, you have Mr. Kenneth Johnson. So all of these individuals make up the Agency for Substance Abuse Prevention, and I cannot thank them enough for their hard efforts and hard work in this fight. So right here, you guys, we have the numbers that were already mentioned before. Actually, from 2017 to 2018, Calhoun County did have a drop in overdose deaths, but from 2019 to 2020, we can already see that those numbers are rising again. And again, I mentioned before that we're dealing with a pandemic on top of an epidemic. So those numbers have increased this past year. So what we want everyone to know is that there are permanent drop box locations throughout our county, throughout our area, at several places. So you see the Calhoun County Sheriff's Department, Anderson Police Department, Oxford Police Department, etc. ASAP has actually also put in, through our own funding, permanent drop boxes at Downey Drugs on Highway 202, at Jacksonville State University, and at the Alabama Institute for Deaf and Blind. So if you're uncomfortable going to a law enforcement agency to drop off some of those old and expired prescription medications, you can go to some of our local pharmacies and anonymously drop off those drugs as well. And again, we really want people to get rid of those old and expired drugs, because you can be a drug dealer and not even know it. Many prescription drug misuse starts at the home, and it's because certain individuals aren't just getting rid of those old drugs. And unfortunately, youth are getting access, and other individuals access to those substances. Right here, what you have is some of our local resources: prevention, treatment, counseling. And for all of you guys that are wondering where you can get this particular list, just please email us here at agencyabuse@gmail.com. Again, agencyabuse@gmail.com, and you will be able to get a list of all of these local resources for yourself or for a loved one. Again, sometimes that people may not know all of the resources that are in a local community, but we have many, many of those. So we want as many people to know as possible all of the local resources that are available. Now, right here, we have, as USA Escalona spoke about, our National Prescription Drug Take Back Day. ASAP does this every year, twice a year. And right here, our upcoming one will be April 24, 2021, from 10 a.m. to 2 p.m. at 4 locations. So we have both of the Walgreens in Anniston and in Jacksonville. We have Wright's Drug Pharmacy in Heflin, and then the CVS in Oxford. And we partner with all of our local law enforcement agencies to implement this event. And this year is going to be especially special because we're going to do a raffle drawing. So once you come up, and again, we'll be following CDC guidelines, and it will be a drive-through take back. So once you come there, you'll get a raffle ticket, and we will pull that raffle ticket, and you will be able to receive a special prize. But again, the overall idea is getting off of the streets, and out of the homes, all of those old and expired medications. So right here, again, going back to USA's Escalona's particular speech, she talked about them partnering with different agencies to implement evidence-based programs. So Smart Moves, Smart Choices is one of those programs. We've had people, local speakers, we've had people from our Northern District U.S. Attorney's Office, and then of course, us as prevention specialists. But this program is, again, an evidence-based curriculum that we implement in local schools throughout Calhoun County to really explain to teens the risk of prescription drug abuse and misuse, and to empower them to address this serious problem. So, you know, to all of you guys, the hundreds that are on this particular event, we want you to know that there are evidence-based curriculums that you can implement in your own community to make sure that people have the information that they need. Now here we have our My Smart Dose campaign. Now this campaign is particularly special because we implement it on our college campuses. And again, we do it at our major universities, we do it at community colleges. So this is something that is very important because we go to those campuses and give out all kinds of information for people to have in order to understand what's going on and just pretty much to raise awareness and continue to do what we do as prevention specialists. So here you've heard this theme come up several times. Hope, hold on, pain ends. So this comes out of our OD2A funding, as Dr. Driver had mentioned earlier. And right to the right of the screen, you see what is what we like to call it our overdose death prevention pill bottle. This pill bottle obviously is in the shape of a casket and it really catches people's attention. But when they walk up close to the pill bottle, all of those local resources that you saw on the aforementioned pages, they're right there on the bottle. So if someone needs help themselves or for a loved one, they're able to immediately see those resources and call that number in order to get what they need. So this right now is currently in the city of Piedmont. It's been pretty much all over Calhoun County. And the next stop will be in Cleveland County in the city of Heflin. Of course, we want you guys to follow us on social media. The Agency for Substance Abuse Prevention, we're on Facebook, we're on YouTube, we're on Twitter, we're on Instagram. So just please give us a call for any resources and information that you may need, as well as if we need to refer you to getting an assessment and other services in order for you or your family member to get help. And right now we want to take a moment to thank all of our sponsors, Ross, we had MedMark Treatment Centers, Alabama Department of Mental Health, Bradford Health Services, Highland Health Systems, Self Recovery, the Jacksonville State CRC, our Collegiate Recovery Community, and the Calhoun County District Attorney's Office. So we truly want to thank all of you guys for 3 years in a row supporting these consistent efforts and just being good community members overall. Our belief is that we can't operate in silos in our community in order to really have true change, that we have to break down those barriers and us all work together. And now what we want to do during this intermission that is still very informative, take a few minutes to show you guys some of our commercials that are going out in the community dealing with our specific campaigns.
Stopping substance abuse ASAP. There is an opioid crisis located nationwide, and ASAP is your substance abuse prevention agency for Calhoun and Cleveland counties. In 2019, we collected nearly 1,000 pounds of prescription medication and drugs. This year, National Prescription Drug Take-Back Day was canceled, but permanent drop boxes are still available to dispose of expired and unused drugs. ASAP is building stronger and healthier communities. Contact us today.
All right.
Where there is pain, there is also hope.
Opioid overdose can happen within 1 to 3 hours. Narcan takes effect within minutes. It is not a controlled substance and it's available to anyone. Call ASAP today for more information. And remember, overdose does not have to be fatal. The Good Samaritan law protects people from being arrested when they call 911 and stay on the scene.
Hope. Hold on. Pain ends. If only I could go back. Drugs ruined my life. So many people tried to help me, but I chose drugs instead. Every single time. If only I could go back. Please don't do this to us. I promise you, there's hope.
Hope. Hold on. Pain ends.
All right. So those were our different commercials dealing with who we are as an agency, as well as the Hope campaign that Dr. Driver had already mentioned. So again, we just want everyone to know that please don't give up. There is hope, and forums like this are so very important because it shows all of the resources that are in the community and different people from different agencies that are working together to try to make this epidemic hopefully soon but surely go away. So now I want to go into our next speaker. Again, as from the previous roundtable, we listened to people and they said they really wanted to hear from people who are in recovery. So our next panelist speaker is going to be Mr. Jeremy Jones from the Aniston Fellowship House. So let's please welcome him.
Hey, my name is Jeremy Jones. Not only am I a person in recovery, but I'm also a member of the community now. Since being in recovery from opioid use disorder and substance use disorder, I have been able to really just gain my life back. And I thank God that there was treatment and that I had the ability to go to treatment. And I wasn't thrown out when I made a mistake. They worked with me, and they were able to give me a second chance and sometimes a third. But in doing so, I've really feel like I've embodied recovery, and I've become a person that I would be proud to be. When before I kind of related to some of the videos, I felt like I'd ruined my life. I felt hopeless, like I really couldn't go on. And then I started to change the way I thought. I started participating and really being open-minded to some of these evidence-based practices that treatment facilities were pushing. And in doing so, I was able to start to get my life back and really start to be able to live. And so through doing that and through living in recovery, I've had experiences and been able to build a life that I could only have dreamed about. Not only am I a person in recovery now, but I'm a husband, I'm a father, I'm a master social worker, I'm a nationally certified addictions counselor, and I'm an employee, and I'm somebody that can be depended upon, where before I couldn't say that. My life was at one time, the only thing that I thought about was getting high. The only thing I thought about was how I was going to get high next. And so I feel like the change that comes about in recovery, people don't really talk about it. People don't really talk about recovery. You see in every movie that you watch, you always see on the news, you always read about addiction and substance use disorder and deaths and all this negative stuff, but you never hear about the recovery side of it. And the thing is there are people in recovery. There are millions in recovery, but you never hear about it, and people don't really keep up with the statistics about it. And so I feel like if we focus more on the recovery aspect, then maybe and get the recovery aspect out there, then it will open the door for other people to want to join, say, oh, okay, well, how this person did it, maybe I can do it too. This person's been through the similar stuff that I have. Let me do it as well. But all the news and media and everybody just wants to focus on the negative. The thing is the positives, at least in my experience in my life, the positives have outweighed the negative like tremendously. And I personally wouldn't change anything that I've done, whether it be my past or anything that I've done, just because my past is lived experience and it's helped me tremendously in my work and going forward. I mean, I wouldn't be doing what I was doing right now if I didn't have my past. I wouldn't be able to go in and make an effective change in people's lives the way I do if I didn't have my past, because I'm able to relate to them on a different level. Well, I don't feel like I'm on that same level anymore because I've maintained sobriety for a number of years at this point. And it's not always easy. I feel like it's for those who are willing to do the work. And for me, I was tired of living the way I was living and ready to do the work. So I did something about it. And thankfully, as I said, there was a place for me to go. There was treatment for me to reach. And so I reached out to the treatment. And I came to treatment. I see it every day. I've been doing assessments all week on people. And, there's just no beds. And so I feel like that's one of the big problems. Why I love treatment, I'm thankful for treatment. There's not enough beds for treatment. People are sitting out here waiting. People are sitting in jail. People are waiting to go to treatment, and nobody's pushing treatment. And so nobody's pushing more beds, and so I feel like that's what we really should more be pushing is treatment, pushing for more beds for treatment, pushing for more money for long-term treatment, because the longer somebody spends in treatment, the better success they will have when they leave treatment. But anyways, I was trying to run through it. I think I am done a little early. Oops. But I guess that's it. I'm sorry.
Hey, no problem, Jeremy. Hey, thank you. Thank you so very much for telling your story and giving us more information. So again, there may be some questions about that and some discussion that comes forth about there not being enough beds. I know that has been an issue in the past. So we really appreciate you sharing your story. So our second speaker from the Anderson Fellowship House as well, who is also in recovery, his name is Mr. Billy Martinez.
Man, I don't know how it went so fast.
Hey, Jeremy, I think you're still on. There you go. All right. Mr. Billy Martinez, he's been with us like from the very beginning and has always supported our efforts. So now we're going to give him a chance to share his presentation. And again, you guys, thank you for still sending in the questions. We're going to get to that section in a moment. Please remember to go ahead and address who specifically that question needs to go to, and we will be asking those here shortly. So Billy, I'm going to let you take it away, and please share your story and your information. Thank you.
Thank you, Sharon. Thank you, Jeremy, and all the panelists. My name is Billy, and I'm a person in long-term recovery. And, I may have had longer recovery if I would have heard of treatment sooner. I started experimenting at a young age, like 9 years old, but I became addicted at 15. When I was 16, my chest locked up. I started off with Percodan. And I remember going to my mother and saying, Mom, you sign these papers, let me go in the military, or I'm going to die or go to prison. And so that's all I ever heard of. I never heard of treatment, never heard of AA or NA or anything like that. And so I thought I needed discipline. So I went to the military. She would only sign the National Guard. So I went to the National Guard first and, got physically fit, got well fed, became, a soldier, came back out and just started drinking beer. To me, that was recovery. I was a little bit, I wasn't shooting drugs no more. I was just drinking beer. And, it was a matter of time before I went right back, because a person without recovery, without a program, is going to get high regardless. And so I went to the Navy this time thinking I needed more discipline. And I ended up getting in trouble for drinking underage and getting terminated from the Navy. And then I ran with the carnival. I ran with driving a truck, and I was just running, because I had this inevitable doom that if it was going to happen, it was going to happen to me. And, I finally got rescued by the legal system. And luckily, I had been to a treatment before in Tennessee, 21 day. And there's a guy sitting beside me. He said, "Hey, you got to make them think they cured you." And I said, "Okay." He said, I looked at him. He said, "I used to be a crack lineman. Now I'm a lineman on crack." And he said, "This is my third rehab, and you got to make you think they cured you." And I said, "Okay." And I had 21 days, and I walked around like that. And, I was listening to people in with me instead of people who were getting better. And so years later, I get rescued again. And back before 2012, it was called rehab. After 2012, because it was all cookie cutter. You went to detox, 28 day, 90 day halfway house, and then outpatient. After 2012, they took on ASAM's, dimensions, ASAM levels of care. And so everything's now depending on assessment to see what people need. And so luckily, I was rescued in DeKalb County where they believed in evidence-based treatment. They would not send somebody to a program that wasn't evidence-based because, see, the process of my recovery started a long time ago, chipping away at the lie of addiction, because addiction, not only did I feel I was in denial, which was not a bad thing, is because I was around so many people that bashed it and made me feel like, if I got honest, I would be this bad guy. And so I protected my soul. And, I went to different things with the treatment, and, I learned a few things. And one of the best things was Dr. Mary Holly told me it takes 3 years for a person like my brain to heal. And I was so grateful to hear it was a process, because I was raised in kind of a Pentecostal church where they went up and laid hands on you, healed, and I wasn't healed. I wasn't feeling it, and it was not working for me. And so, I was so grateful to hear it was a process. I went to a 28-day program, went to a halfway house in Gadsden, was striving to do the right thing. It just didn't go from here to here. I relapsed, realized that everything they said was true, got rescued by the legal system again. Thank God for the legal system, the people who who believe in treatment, who are the police, the court referral officers that really believe in treatment, the judges, all these people who believe in treatment and know that it's a process. And they say it takes 5 years for a disease to be in full and total remission. And so then I got rescued by the legal system. And then I came to the Aniston Fellowship House. And you got to see, I'd been running for years, so I never really knew how to live. I didn't know how to, I drove a truck, or I traveled with the carnival, sleeping in these tents and stuff like that. Just crazy, just a wild wildebeest. And so got rescued, learned how to, there's so many evidence-based practices going on in the fellowship house that I didn't really realize that was going on, like signing out, learning, behavioral therapy, cognitive behavioral therapy, learning how to tell people I'm going somewhere and be back and be able to go on my own and face problems in society instead of ducked away and drove around in some van where I can't even learn how to walk to the store and say no. And if something's shaking me up, to run back to the treatment center and say, I'm not ready to go to the grocery store yet. I don't know how to face my problems. And be around people that teach me stuff like rational emotive behavior therapy or 12-step theory, or all of it together. Because who am I to say how I will get well? I thought the military, I thought this, who is other people to say how I'll get well? So everybody's got their own process. And just because somebody falls out and comes in and out of treatment, maybe in and out of the MAT program or whatever, that's their process. It's a process of change. And it takes time for me to replace the lie of addiction with the truth of recovery. When I came to Aniston Fellowship House, I had met the director, and I knew he was an addict like me because I see the scars on his arms. But I could tell by the way he talked that he was better. That little bit of hope helped crack this wall of denial, where I can say, my name is Billy and I'm a junkie. I can't stop. And, that helped me opened up my mind to be a little bit better. You know, it talks about willingness, keep coming back, keep going to meetings, keep doing whatever. You know, somebody gets a year clean, that's really just peanuts. You know, it took 2.5 years before I felt like I was going to be okay. You know, we got to realize that this is a process. It's going to take time for people to heal. Not because they got on MAT for 30 days that they're better. They might sound better, but this is a process. It's going to take time. And treatment allows time. I was allowed to come in here to my brain healed. I was able to learn how to work. I was able to pay my fines, get out of my legal troubles. Even though I went to jail with a year clean, that was part of the process to repair the damage of my past, to get a full pardon and then go to college. And I'm not the only person in recovery who does that. And that's an amazing thing, that people who, you know, make a decision and take action get better. You know, there are treatment beds. There's all kinds of levels of care. You can find treatment. Sometimes, like this level, you might have to wait for a little while, but you have to be clean to come in here 72 hours. So, you know, there's high intensity 3.5 like Bradford. You've got other places. If you don't have insurance, there's treatment available, you know, and no matter. Oh, I didn't hit something. Anyways, there's treatment available. And, you know, we do assessments. You can contact Ross to get assessments in the treatment, but it took time. And that's what I got to say. Things I must earn. It's going to take time to heal. And recovery has been the best thing that's ever happened to me, because, you know, if I would have went the way I thought things would have went, I probably would be dead now. You know, it's amazing. If I would have heard about treatment in school when prevention came, because 1 out of 9 people are addicted. All right. And so that's even in school. So when you got kids in there, 1 out of 9 of those people are going to be addicted. And so they need to realize, because I thought they brought prisoners in saying, this is what's going to happen to you if you use drugs, you're going to prison. And, you know, I looked at everybody on my row and said, we're going to prison, because I never heard of treatment. I never heard of recovery. I never heard of there's a way out besides jails and institutions. I seen those movies, One Flew Over the Cuckoo's Nest. I seen what they did to people in the old black and white movies that for alcoholism. I thought, if I get honest, what's going to happen to me? Where's the hope in that? You know, so I'm just grateful that, you know, that this process of change, you know, that I realize that it's a process. And sometimes we have to fall. Sometimes people have to go to prison. Sometimes, you know, the bottom line is, when you get into a program of recovery, when you understand the problem and then you understand the solution, at least if you're sober for that period of time, you understand you have a choice. I never thought I had a choice. You know, I never thought I could get better. Once I identified the problem and the solution, I was able to make a decision to do something different daily. And when I began to work a program and learn about these spiritual principles, morals, or ethics, or whatever you want to call those things, you know, and practice them and believe them, because that's another thing. I didn't know what I believed. Go to these churches, I see people hands up. I wasn't feeling it. I'm a drug addict. I want to feel something. So here I am. I ain't feeling it. You know, and recovery is not about feeling. It's about healing. You know, but I got to feel my feelings to heal. And so, you know, when I began to introduce Billy to Billy, the good, bad, and the ugly, you know, it was part of this process. So, you know, if somebody messes up, you know, don't count them out. People die, you know, and it's a shame. And, you know, but people get better. But the quicker we can get somebody into treatment, and sometimes families enable people to death. You know, sometimes it's like, you know, people who really want to get better need very little help. You know, but there are some humps. Like, I had used MAT to quit smoking cigarettes. I used the patch. I followed the program completely. June 30th, 2007. I haven't smoked a cigarette since. Beer in the military was my MAT, believe it or not. So, I mean, there's processes that may not be recovery to some people, but to me it was. So, you know, I'm just grateful that that there is recovery available, there is treatment available, and if you want to find it, you can contact me at the Fellowship House, Jeremy, Dina Boyling with Ross. You know, there's some 800 numbers. We can do assessments. You know, some places you have to wait for, but I mean, you had to wait on the dope, man. I mean, let's get real. So you're going to have to wait for some hope, man, because you want to get to the best treatment available. You know, if it's evidence-based and like someplace like here, it's not, they're not going to break you. It's $100 admission fee, $75 a week rent. You learn how to work. You're going to hear about recovery from people who are in recovery. So, you know, we're not supposed to be locked up in prison bust to, you know, work as slaves. You know, we're here to learn how to become men and take care of our families. So I hope that, you know, people will realize that, you know, we're not bad people. We're people with bad problems. And when we face our problems and our feelings in other people's experiences, we can get better. So, you know, I hope I didn't ramble on. I don't know if that's all my time or not. I can keep going, but, you know, I'm just grateful that that the state of Alabama, Department of Mental Health, pushes evidence-based practices. A lot of court referral programs in the state of Alabama push evidence-based practices. All these places push evidence-based practice. That means that somebody has researched it and said this works. You know, places that are not evidence-based just do whatever they feel like they want to do. You know, and people, you know, go to them places and think that's treatment. And it's like, you know, I got to go to treatment, but I don't want to be locked up for 2 years. You know what I'm saying? I want to be at a work release. And I understand that, you know, but that may be part of some people's process. So I'm just grateful that, you know, not only are we a treatment program, but we also have foundation housing, and people have stayed as long as they needed to get their life together. I've seen people come here and become doctors, go to school. I've seen people come here and be social workers, welders, fresh out of prison, got families, taking care of themselves. People get better. I've seen people go to prison who never wanted to change. That was their choice. They have a choice when they identify the problem and the solution. And that's what we need to offer people, a choice. You know, because we're going to make our decisions based on what we believe, not what you believe or what anybody else believes, what we believe. And if I keep thinking that what I was doing, it's like they say insanity is doing the same thing over and over, expecting different results. That's not insanity. Insanity is making the same mistakes, expecting different results. If I don't consider it a mistake, it's not insanity. You know, I just got caught. So I don't want to keep making mistakes. It's okay to make new mistakes. It's just not okay to make the same mistakes. And as soon as we learn that kind of stuff, thank you. As soon as we learn that kind of stuff, that this process of change, that different people, different levels, different devils, whatever you want to say, people are on different levels. And, you know, we've got to meet them where they are. It's individualized treatment. You know, some people, it's not cookie cutter. Some may need detox. Some may need MAT. Some may need just REBT. Some may need 12 steps. You know, we got to set the table and put all these things on the table and let people pick up what they feel they need and change when they get ready. So, you know, if you know somebody who needs treatment, you can contact Department of Mental Health. You can contact anybody who works with Ross. They provide transportation and everything. You can call the Fellowship House. You can call Serene. You can call anybody that works with Department of Mental Health or treatment and find a bed. They take pregnant women with children, adolescents. You know, I was 16, didn't know I needed some help. There's treatment available. Thanks for letting me share.
All right. Thank you so very much, Billy, for that riveting testimony to both you and Jeremy. And I just want to remind people, you guys, that, you know, the butterfly sleeps in the cocoon. The oak tree sleeps in the acorn. The bird waits in the egg. And I love that Billy kept talking about and hitting on, it's a process. It's a process. And, you know, I think a lot of times in our different settings, and especially as being here in the South, like he said, many people say, oh, well, just pray it away. Just go to church and pray it away. And that keeps feeding into the stigma that doesn't need to be there anymore. And it hinders people from actually going to get the help that they need. So I'm so glad that he was able to hit on those various points. And I truly appreciate both of you all's testimony. And I hope someone was able to get something out of it. So what we're going to do now, you guys, there have been just all kinds of questions that have been flooding in, but we're going to try our best to answer as many as we can. So I need all of my panelists to come back and get ready to answer. And what I'm going to try to do is go in order of you guys as panelists, all of the questions that came in. And please, try to answer the questions in like a minute or two, so we can get to the other questions that have come in. So again, we're going to answer all of the ones. So the first one is for Dr. Driver. The question is, what other initiatives does the Office of Prevention have going besides OD2A? What other prevention initiatives does the Office of Prevention have besides OD2A?
Yes. Again, I kind of spoke a little bit upon one of the initiatives that I kind of work with, and that is the SPIF-RX. And that particular initiative looks at educating the public about prescription drug misuse and how your drugs are specifically for you and not for others. The CCI initiative, Community College Initiative, where we talk about in community colleges, but also in some colleges and universities about underage drinking and substance abuse. We also have the block grant, and the block grant is implemented within every county within the state of Alabama. And it is our largest grant that talks about substance abuse and misuse. We also provide resources too, in retrospect to trying to link, providers and coalitions and communities together, like you all have said, because it's a working partnership. Again, I'm going to go ahead and I'll put my email address down at the bottom also. But if you would like more specific information, because I only have a few minutes, I'll be glad to talk with you more specifically about that. But those are some of the initiatives in the office with the Alabama Department of Mental Health Prevention Services. Thank you.
All right, thank you for that, Dr. Driver. The next question goes for Mr. Pat Brown, and I'm going to try to tie two of them into one, if you don't mind. I mean, it's a lot of questions, so I'm going to try to tie two of them into one. The first is, how do you think people are getting their hands on heroin? And the other is the no-show something that has been around for a while, and will it likely become more common?
So as far as how they're getting their hands on it, it's about supply and demand. It's not hard, from what I gather now, to find heroin. It's probably as easy to find in our community as marijuana is. It's here. It's going to stay. As far as specific locations, I wish we knew, because we could share those with a lot of folks. Matter of fact, today alone, I've had two families call me. One was from a death in 2017 that they know where their daughter, who died from a heroin overdose, was getting the heroin. And he has been reaching out to local law enforcement and myself, trying to get something done about this person. Even so much that the person friend requested him on Facebook, he said. So as far as specific locations, I don't know, but I know it's out there and it's easily found. The second part of that question was about the no-show. Now, no-show was something that came to my attention in the recent weeks due to a death in of a state inmate that they believe, and this is problematic with this drug because it's not traceable after the fact, but they believe that he had gotten a no-show, which again is a chemical that they soak on paper. And in a lot of cases in our institutions, they're doing cards and letters to inmates. And on these letters, they're soaking them, writing them a letter, a short note, and sending it to the jails. And they get it, and the people know what it is. And that's when they roll up that piece of paper and they smoke it. The effects it gives, I'm not real familiar with. I can't speak intelligibly about those drugs, but I know that I know our local sheriff's office now, because of this very incident, I was speaking with the sheriff last week. When you get a letter sent into the jail, they're actually having to make photocopies of that and then give those to the inmates. So the stuff that's out there, that's putting the deputies and the people that handle the mail in danger. I know we spoke about earlier, we were talking about fentanyl and some other things. There's some drugs out there that if you just come in contact with them in the wrong way, paramedics, fire, police are dropping as soon as they walk inside the doors. So I know that was not a very good answer to that question, but that's part of our problem. We're trying to figure that out as fast as we can, and I may have lost you. My internet dropped for just a second, but to finish that up, I said that our biggest mission right now is to try to figure that out, and we're behind the power curve on doing so.
All right, thank you for answering that question. Our next question goes to Dr. McVeigh. The question is Suboxone addictive, and is it easy to eventually stop taking that substance? And Dr. McVeigh, you're on mute. You're on mute. So please start back over.
Thank you. Can we start over? It is addictive, but it does not develop tolerance where you have to go increasing dosage. You okay there? About 10% of the people are able to transition off of it. A lot of people stay on it indefinitely. At the induction or initiation, we talk to them, and it is not by my timetable. It is the patient's timetable when they feel comfortable. A lot of them are, they taper down to a dose that is so small, it's a fraction of a 2 milligram strip every other day. But they're just afraid to, as they've said a number of times, they're afraid to go back to what they were before, to not have it in their habit and become where they're always thinking about their next dose. I think that has a lot to do with how difficult it is to taper off of it. But I think the percentage is about the same percentage of my diabetics that are able to come off their medicines for diabetes, and my hypertensives, they're able to come off their medicines for their blood pressure. And if you look at it as a disease, we're treating the disease. A lot of diseases we treat, we don't cure, we treat. And addiction is a disease, and we're treating it.
Thank you. Thank you very much for that response. All right. So the next question is for USA Escalona. And I know this may be a little complex, but you may have to speak about it in general. But the question is, have you prosecuted any of those doctors or pharmacists in the Calhoun-Cleburne area? If so, how many and how recently was the last arrest or conviction?
Okay, thanks. Yes, I'm a little bit limited, you're right, in what I can talk about. We can only share what is public information, and I'm not allowed to comment on what could be some potentially ongoing investigations that are not public at this point. But what I can tell you is that we've done 30 convictions, kind of across, over 30 across the district. There have been no public convictions in Calhoun or Claiborne yet, but we certainly have a wonderful working relationship with the law enforcement, the local law enforcement in both of those counties. And so we're always willing to take cases. And that's probably about the extent of what I can say in specifics about cases that might be pending at this time.
Thank you for that. And yeah, guys, those who are asking questions, I did somewhat know that they can't speak about ongoing cases and things of that nature, but thank you for answering to the best of your ability. The next question is for Mr. Jones, Mr. Jeremy Jones. Do you have any suggestions for ways of encouraging people to seek treatment when use seems to be outweighing the thought of not using?
Use seems to be a night.
And let me know if I need to
I think
repeat
it
it.
comes down to a point where I can only speak from my experience. In my experience, it got so bad to a point where if, I was almost analyzing and like fighting myself about it. So it was almost like a cognitive dissonance kind of thing. Over here, I wanted to do this, but my actions were doing this. So I was really just fighting myself on it. And I knew I wanted to do something different, but didn't quite know what to do. Well, then that's probably the time where, okay, maybe I need to change my environment, and maybe I need to seek treatment and start to seek some help. But and so at that time or around that time, I actually, like Billy was talking about, I went to a higher level of care. I went to a 3.5 and then kind of transitioned down. But, when you're currently using, or at least when I was currently using, it was if it weren't for the criminal justice system and being arrested, then I probably wouldn't have went to treatment. So, I mean, a lot of times I have some conflicted views about the criminal justice system and coerced treatment, but at the same time, I was a participant of coerced treatment and it worked for me. So.
Thank you for that. Thank you for that. The next question is for Billy, and it's kind of two questions back to back. The first question is, what do people do if they don't have insurance?
Plenty of treatment available for people who don't have insurance. Department of Mental Health, certifies and provides funding for places. Not having money is not a reason not to go to treatment. Not having money does not prevent treatment. If you call somebody and say you can't get into treatment because you got no money, call Department of Mental Health, report that, because you can get into treatment. Now, there are for-profit places. There's a list on the Department of Mental Health for for-profit places. You got places that take insurance. But if you don't have insurance, there's places that don't take insurance that are that are self-pay. But it's minimal and it's cheaper than dope. So, you can get treatment with no money, and there's treatment for women with children. There's treatment available, for all kinds of people. So, sometimes people have to do what they feel they need to do before they get ready for certain things. And people can make excuses for different things for not getting treatment nowadays. And, I heard somebody say something about Tiana's and stuff. And sometimes that might be something to keep somebody alive or keep them until they hit a bottom. Because to me, a bottom is a place when people quit digging, when they quit lowering their standards. I'm sorry. A bottom is when people quit lowering their standards. And so sometimes we have to get to an animal level until we can look up and get up. So, but you can find treatment. Dina with Ross can help you find treatment, provide transportation. There's no reason not to find treatment. I can refer to a bunch of places. I have a list right here with all kinds of different levels of care. There's like 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13 programs like the Fellowship House in the state of Alabama, right? Residential, low intensity programs where people can go to work, learn how to take care of themselves, pay their fines, get on their feet, and they're not broke. They get their ID, social security card. They're not like a slave at some of these places. Their ability to stand on their own feet and walk to the store. There's treatment available. So, and you know, there's also outpatient. People don't need this kind of level. Some people have jobs doing well. They can go to outpatient. If you got a job, you got insurance. Bradford's got a great program. You can go to outpatient. There's other outpatient programs around too for people who don't have insurance. So it just depends on what type of treatment somebody needs. So you can find treatment. And I hope that answers the question.
It does. And let me do the follow-up question that they have for you as well, Billy. How many beds does the Anderson Fellowship House currently have? And is it usually at full occupancy?
Okay, we have 18 beds, and we're going to build another facility soon next door with 13 more beds. But we have 18 beds. The program's 2 to 6 months. We don't rush anybody out. It's, you know, normally about, you know, it's 2 to 6 month program, but we have foundation housing for people who want to go further. So, but, you know, we work off of a waiting list, and the waiting list may be long. You may have people waiting from jail who can't get it released. You may have people waiting who are in high intensity and refer to every program in the state and never hear from them again. So when we go down the list, you just go down the list and you look at who's called, where they're at, as their probation officer or whoever put them on the list, saying where they are, what their number is, who they can contact, can they be released? All this stuff is on a list. When they call us, we can look through and see if they've been calling us. Why haven't they been calling us? You know, and we go down the list and find out, you know, either some people refuse beds, some people, you know, went to other programs. You know, there's a list that, so as far as getting into the program, it's really, you know, about two, you know, sometimes quickly, sometimes slowly, but you can get into treatment at the Fellowship House in Anniston. Sometimes you have to wait. It just depends on a lot of things. You know, is the judge going to let them out of jail? Sometimes they want us to go to the jail and do an assessment. We'll go down there and do one if they can be released for treatment. The problem is around here is they want to release them to these work camps for like a year or whatever, you know, and then they're calling us from these camps saying, you know, I can't, whatever, I need, this is not what I need. And it's like, well, you have to have an assessment because we are certified and we have to have an assessment because, see, this assessment works off 6 dimensions, you know, withdrawal, you know, it's biomedical, cognitive problems, you know, and then it's got readiness for change, relapse, and then living environment. You got 6 dimensions. So you can assess somebody with these 6 dimensions and see what's going on with them to see what level of care they need. It's not cookie cutter. You can't just say somebody needs to go to a year-long program and think they're going to be successful and wonder why they've been in these places for years, because they're not using the evidence provided by people who have researched this to see what's going on. And so, you know, I think it's abuse. I think it's kind of abusing the person who's seeking treatment. They're people who are sick people trying to get better, not bad people trying to get good. You know, I really believe they should have some kind of igloo set up where they can put people into pajamas when they get rescued by the legal system and talk to them how sick they are until a bed comes open. If they mess up, put them back in that place. You're sick. You're a sick person. Instead of putting them in with a bunch of convicts who talk about snitches and all this kind of stuff, and then you have to deal with all that, you know, and that's probably high intensity to work with people in that level of denial. So, you know, there's a lot of changes that need to happen in a structural level to get people to get well. I mean, so, you know, you get a little marijuana smoker or somebody who just used, you know, simple mild use disorder, who just, you know, got a prescription for a broken finger in high school, and then he, you know, gets in a little trouble. Next thing you know, this guy's in one of these damn slave camps and comes out with tattoos all over his head. So.
All right, thank you for that, Billy. We really appreciate that. The next question goes to Mr. Pat Brown. and it's kind of loaded, so just kind of bear with me. And let me go ahead and say in advance, because we are getting low on time. After Pat, then Dr. McVeigh, there's another question for you. And then to all of the panelists, you guys are going to have an opportunity for like a 1 to 2 minute closing comment. All right, so Pat, this question is, my sister died after a battle with pain medication in 2018. The paramedics gave her 4 rounds of Narcan, but they lost her when she was getting put in the helicopter. Since she was an organ donor, there was no blood work or anything done to determine the actual cause of death. My family always assumed due to what happened that it was an overdose. How does your office count instances like this?
So there's some variables there that I'm not sure about and probably wouldn't be for the group. However, let me just say the number I gave earlier, if someone wanted to contact me, if this individual with a question had it and wanted to call, I'd be glad to speak with them individually about it. But as a general rule, if you die outside of a hospital setting, then it's law that I've got to be notified of that death. And we will, whatever the evidence is showing at that moment. And it's possible that you can have a drug overdose death. Sorry, guys, I lost you again. I don't know what's going on with the internet, but it is possible that you can have an overdose death and it be classified as an overdose death without toxicology ever being drawn. If they were to be, and it sounds like if paramedics took them to the helicopter, that the helicopter, and the question I would have is if they were in flight or not in flight, because that would make a difference. But I don't have enough information to answer that question, but it's possible that it could be ruled a drug overdose, or it could be ruled, depending on other variables that were there. And that's the one thing I was going to say on, is a lot of these deaths, if they were in the hospital longer than, 24 hours, it's not mandatory that these hospitals even notify me. So our death numbers could be higher, and more than likely are higher than we report.
Thank you. And Pat, if you could please just put that number that you talked about into the chat box, so those who are wondering could go ahead and ask, whatever other questions they may have. All right, and this last question, it goes to Dr. McVeigh, and then again, panelists, I'm going to give you guys 1 minute to just give some closing thoughts. Dr. McVeigh, the question is it a battle with the insurance companies to get the correct medications for patients trying to come off of opioids?
That's getting better because of some laws. It is still a battle, but they give in more easily. We usually are able to get the prescriptions. There may be a day or two delay. When we first get started, I tell the person not to file on their insurance. We give them a prescription for very few of the strips, tell them to pay cash for that. So that's to get things started. Give them another prescription. So we have a day to work on the insurance so they can get it filled. So we work around it.
Thank you, thank you, thank you. All right, well, again, I want to thank all of you guys as panelists for joining us. We're going to get to the end of our agenda, which are going to be some quick announcements. But before we do that, just again, some closing thoughts from all of our panelists. Let's start with Dr. Nicole Driver.
Thank you again for this wonderful opportunity. The Alabama Department of Mental Health, we are providing some very wonderful services, prevention services. And William, as you stated, and I really appreciate that, treatment services, the services are out there. Please don't forget this message that you heard tonight and spread the word. Again, we don't want our initiatives to go in vain. And again, we need you all. We need you all to continue collaborating with one another, working with one another, but keeping these initiatives moving. driving and thriving. This roundtable is exceptional. And I mean, it just really brings joy to my heart, a community coming together and really reaching down deep within and working together with one another and sharing together with one another, but also sharing outside of your community with others. It's important. What you are doing is important. And ASAP, I just really appreciate it. So thank you all so much. Again, we provide wonderful services. You can also just type in any web search also, Alabama Department of Mental Health, and it will provide the different entities within our system. Because again, we do have a lot of services that we do offer that are needed here in the state of Alabama. So again, thank you all so much.
Thank you, Dr. Driver. Mr. Pat Brown, please.
Yes, thank you. And I'll be brief. I just wanted to add some weight or merit to this meeting that we've had tonight. I want to thank all the other panelists. This is probably one of the best group of panelists we've had. But as we've been, I know some of you may see me looking off too, among some other texts I've had. Currently, I've got my guys heading out to an overdose, more than likely. And so as we speak, it just doesn't stop. So, Billy, thank you for your inspirational talk along with others. And one of the things that you said, and I totally agree, and I have a different take, rock bottom is also a great place to build a foundation. So take that. I don't want to see you guys unless it's at the store. I'm happy to do so. Happy to answer any questions. We appreciate everybody that's taken their time. And those of you that are here listening have taken your time out of your day to come and to be an attendee here. And that speaks a lot. And you guys go a long way with helping us. So thank you very much. Appreciate all that you guys do and hope to see you out there soon.
Thank you. Thank you. And now on to Dr. McVeigh.
Thank you for letting me participate tonight. I don't want to reiterate what Billy said. This is addiction is a complex problem. There's not one solution. There's a number of solutions. What works for my patients may not work for everyone. And I have referred patients on from, I don't drop them, but we keep them in our program until we're able to get them somewhere else if what we're doing is not working. And it's not one size fits all. Thank you.
Thank you very much. All right. And again, we can't thank you enough, USA Escalona. I mean, we know your schedule is so busy, but thank you. And for all your office does in partnering with our agency to do these different initiatives. So please provide your comments.
Goodness, I think I'm probably the least important person on this panel. So I'm just honored to have been invited and to be able to join this group of impressive individuals. And I just wanted to say my personal thanks to the other panelists and especially to Mr. Martinez and Mr. Jones. I know that it takes a large amount of courage to come on and tell your story, and I appreciate it. And it was impactful for me, and I know that it was impactful for others who are with us tonight. So thank you so much for doing that. And thank you all for the work you're doing. Again, anything that my office can do to help, be it from an enforcement aspect or from outreach prevention, we are here to support your efforts. We are here to work with you. So please let us know, contact us, reach out to us, and let us know how we can help. Thank you so much.
Thank you very much. All right, Mr. Jeremy Jones, please share.
I just want to say I appreciate ASAP and the work that y'all are doing in Calhoun County. I've seen y'all and y'all made stops by here, and I appreciate y'all and even for having me at this round table and allowing me to share my little bit of an experience. And then I would just like to say that, if anybody needs treatment or help with treatment, please don't hesitate to call up here and ask. We can point you in the right direction or help any way we can. You can call Dina with Ross. She's the Calhoun County Ross worker, and we can collaborate and get you into treatment if somebody needs it, or if you know somebody that needs it. Being on MAT is not a deterrent. We accept clients with MAT, and we work with everybody that we can. So Thank you.
All right, let's go now to Billy, our main man. Thank you.
Thank you all for having me, and thanks for this roundtable. I really appreciate what we're doing. We're outreaching to people. If one program's not working and you fail out, there's several programs. Keep going. Finally, you run across somebody who will share some hope with you, and that pain will end. Thanks. Let me share.
Thank you. Thank you so very much, Billy. All right. So now that brings us to our announcement portion. So many different wonderful agencies have helped us put on this particular event. So right now, we just want to start off with our quick announcements. Again, I already mentioned our April 24th Drug Take Back, National Prescription Drug Take Back Day, 10 a.m. to 2 p.m. So please, if you need any other information about that, contact the Agency for Substance Abuse Prevention. Number two, our ASAP scholarship competition is out there. You can go on our website, asaprev.com, and look for the scholarship application. We're giving out $500 scholarships to deserving Calhoun and Cleveland County students. All you have to do is write in an essay. We have a panel of judges that will be judging those essays, and we do want to award you some money for college. And then last but not least, the ASAP survey that will be coming along with the evaluations. Please look for that. Again, we want your feedback. We want to know how we can continue to make this event better and make sure that we're giving our consumers the information that they need. So now let's go to Wendy Sprayberry with MedMart Treatment Center. Let's let her provide the updates with her organization.
Thank you so much. We appreciate the opportunity to share, and it's an honor to serve with the Opiate Roundtable Committee. When the members of that committee in this opiate crisis, we do provide medication-assisted treatment using methadone and buprenorphine, along with counseling. One of the things I wanted to share that we're excited about is we've been awarded federal grant money through the Alabama Department of Mental Health to assist with treatment expenses for people who are underinsured. We do accept commercial insurance. We accept Medicare and Medicaid. But now we have this grant opportunity, which will cover the treatment services for 6 months. And so anyone who is interested in medication-assisted treatment at MedMart Treatment Center of Oxford, just give us a call, 256-831-4601. And I'll put that in the chat in a moment. And we will do a brief screening with that person who's interested in treatment and get them an assessment scheduled immediately.
Thank you very much. All right, let's go to Mark with Ross.
Thank you. It's an honor to be here. I am with Ross, the Recovery Organization of Support Specialists. I am going to share my screen real quick. I want to talk about the Ross 24/7 helpline. That number is 844-307-1760. We are the first peer-run organization in Alabama. All of our certified peers are individuals in recovery from a substance use disorder, and all of our services are free of charge. You can call that helpline at any time of day or night, and what a caller receives is contact information for recovery resources, including the treatment provider in one's area, as well as support groups, shelters, and anything else requested, someone to talk to who has been where they are, and they will connect them to an outreach peer like Dina Bowling, who is our outreach specialist for Calhoun and Cleveland counties, who will help them to navigate the substance use disorder system of care. We've got a lot of grants right now. We're working with expectant mothers through our statewide opioid response grant. Obviously, being an expectant mother in the state of Alabama can pose a lot of challenges. And we're working with veterans as well. We have a Pardons and Paroles project. We have a Bureau of Justice grant, and we're helping with individuals who have been incarcerated, finding reentry into their communities. Everything that we do is free. That's why we started Ross, to reach the people who fall through the cracks. And our outreach is literally the boots on the ground. And we are across the state, and everyone at Ross is in recovery. And that helpline number, once again, is 844-307-1760. That's 844-307-1760. We're also working through Project Freedom, the University of Alabama, to help distribute naloxone to surrounding counties. And I'm actually training volunteer fire departments. So it's an honor to be here. Thank you for having us. Please contact Dina Bowling. She is our outreach specialist for Claiborne and Calhoun County, and we are a free life-saving resource. So thank y'all.
All right, thank you very much, Mark. So again, thank you for joining us at our 3rd annual Opioid Roundtable, and we hope you guys continue to stay safe, and we'll see you next time. Thank you. Have a great night.